Hello, everybody. Welcome to the Multiple Myeloma Warrior podcast. My name is Noose Sharif, and I'm with Polygon Health. I will kick things off by introducing myself, of course, and I also have our guest Michael here as well. But let me tell you a little bit about the Multiple Myeloma Warriors group. What we're trying to do here at the Multiple Myeloma Warriors group is connect like-minded and patients of multiple myeloma to researchers and other opportunities that are beneficial for patients. Our goal is to help optimize the multiple myeloma journey and help researchers improve medications and find a cure. We're trying to tell multiple myeloma patient stories and help other patients manage and benefit from hearing these stories. So with that, I'll introduce you to Michael, a Cornell alum who got connected to us through another Cornell affiliation. Michael, would you like to introduce yourself and give us some background?
Sure. My name is Mike Mankowich. I'm 6 years into this journey. I was diagnosed 6 years ago. I had chronic back pain, and I'd seen a number of doctors. Finally, one of them was smart enough to send me off to get a scan done. And got an MRI done, and within 8 hours of having that done, I got a phone call asking me where the doctor asked me if I knew anybody at Sloan Kettering. That was the first indication that there may be a problem. And he told me about the scan and how the marrow had lit up, and it was probably one of two things. The first, which is rather broad, was metastatic disease. The second was multiple myeloma. I was seated at work when I got this news. Didn't make for the greatest day. Hid it from my wife for a few days. I wanted to get some more information before speaking to her about it. But she, being the astute woman that she is, she picked up on my somewhat off mood, and I had to tell her after a couple of days before I got the results of any other tests. I eventually found out that it was multiple myeloma. I was, strange to say, but I was ecstatic, knowing that I did not have metastatic cancer at the time.
Mm-hmm.
So, but then I started to dig and did a little research in multiple myeloma, and realized that wasn't so cool either. The one statistic that really jumped out to me was the fact that maybe 55% of the patient population at that point in time made it beyond 5 years. And given that I was 56 at the time, 5 years was not going to get me very far. Obviously, things worked out. I'm in remission, so to speak. Technically, there is no remission. My state is I'm minimal residual disease negative, MRD negative, and life's treating me well. Got pretty banged up in the beginning during the initial treatment phase. It's called the induction phase. So that ran for 3 or 4 months. Do you want me to go on to share what exactly that encompassed, what I took?
Well, yeah, absolutely. Before we get to that, I wanted to ask, like, when you first got diagnosed, psychologically, how were you feeling, and what were the initial action steps you took once you had the diagnosis, both yourself as a patient and sort of with your care team and your family, the caregivers?
Okay, I got the diagnosis. I had my doctor email me a copy of actually, I think he faxed a copy of the report. And in the report, I saw written that it was likely either metastatic disease or multiple myeloma. So I sat with that at my desk, just kind of looking at it for a little while. Needless to say, I mean, I was totally taken aback and somewhat in a state of shock. Uh, I wound up when I spoke to the doctor and he asked if I knew anybody at Sloan Kettering. Uh, I didn't. So he went. He found a doctor for me to go see. It was somebody that was actually part of their oh, God, what uh, I think it was orthopedic. Yeah, he
Mhm,
was in the orthopedic group.
mhm, mhm.
And this wonderful guy with this great Irish brogue, who's probably about 70 years old, and he was a panic. Anytime he had questions of other doctors. Instead of scheduling appointments, throughout the course of the week, he was walking me all over the hospital, walking me into rooms with other doctors, having tests done on the spot, and uh, he was great. And then he in turn was able to diagnose the multiple myeloma, and then handed me off to a doctor by the name of Tani Hassoun, who was a multiple myeloma specialist, and he's been my doctor, pretty much from that point going forward. For the longest time, was seeing him on a monthly basis during my treatment phase. Actually, went off treatment
Mhm.
about 6 months ago. So now my visits to Sloan Kettering in Manhattan take place quarterly as opposed to monthly.
Got it. Got it. Okay. So that sounds good. In terms of medications and treatment, maybe you can talk about, your journey and what worked and what didn't work for you.
Okay. I was pretty lucky. Pretty much everything worked.
Oh.
Story over. No. Um, okay. I was part of a clinical study where there were two groups. One group would go on to they'd go through an induction phase where they took Revlimid, Velcade, and dexamethasone at a certain dosage, and then would then go on to a stem cell transplant, SCT. The other group, uh, what they basically did was they doubled down on that induction period, and I believe the dosages were higher, and then skipped the stem cell transplant procedure. The What they did though is they did extract uh, your from your marrow platelets that could be used down the road should that not work out and you need the transplant. So I have somewhere frozen at some office at Memorial Sloan Kettering. I've got God knows how many liters of platelets that are frozen and awaiting my arrival, which if I'm lucky, never comes to be. But that worked out for me extremely well. I during at the close of this induction period, I was in remission, MRD negative, and never looked back. I've been MRD negative for close to about 5.5 years now.
Got it. Got it. So it's really the combination of those three medications that really worked. You couldn't attribute it to more of one versus the other.
Well, the Velcade and dexamethasone are, I think they're there to almost boost the impact of Revlimid. I think Revlimid is the primary underlying medication. It's in our world it's chemo. And after that first 4 months or so, uh, I was taken off Velcade and dexamethasone and just continued taking Revlimid for maintenance purposes. And that's what I just stopped taking that about 6 months ago. But I mean, all things were, like I said, I was pretty beat up at the outset. And I actually had gotten neuropathy I think that's a result of the dexamethasone. And I was taking I found out after the fact that the dose they had prescribed for me for Revlimid was very much on the high side. I found out during one of my trips, which I took with other caregivers and doctors and whatnot. And I spoke to another multiple myeloma specialist who, while we were out hiking, talked to him about the dosages I had been taking, and he was like, "Oh, that's pretty funny." He goes, "Oh, we figured that out. We figured that was too high a long time ago."
Mm-hmm, mm-hmm.
In the study, they just allowed me to continue down that path, and I was taking 15 milligrams daily without any breaks. I
Got it.
think the norm was most people once they figured things out, they were taking 5 or 10, and they take it for 21 days, and then there'd be a 7-day break, and then they get back into the cycle. Me, it was just that 15 milligrams nonstop,
Got it.
but no worse for the wear, so I can't complain.
Absolutely. And so, like, what were some of the physical or psychological impacts of going through the medications and, just the feelings that you were having during this time?
Well, the Dex is oh, Dex kind of hypes you up, puts you on edge, makes you somewhat irritable. It's a drug that's probably more difficult on one's spouse than it is on the patient. So yeah, I didn't think I was that bad, but my wife was kind enough to let me know after the fact that I was. Uh,
Got it.
so
Oh, is there more?
the others, I mean, and the Velcade, like I said, I mean that I had gotten neuropathy from, and I still have it
Mm.
to some degree. And that was at one point it was somewhat difficult to drive because you can't feel your feet, you can't
Hmm.
feel a brake. So
Gotcha. Gotcha. And so you mentioned your wife, as a caregiver, and what advice sort of would you have to folks, to patients and to caregivers to sort of, manage the situation better?
just, I mean, you've got to keep an open line of communication with your wife or your spouse, and you need somebody to talk to, and you just as importantly, you also have to make sure you listen because uh, when you're, especially during the initial treatment phase, you're not seeing things, or you may not be seeing things as they are. Your view and opinions may be somewhat jaded by your situation. So, and that open line of communication is really important because your wife has to know that she should feel free to share with you her perspective of what's going on and how you're behaving, and because you don't you never get the full picture. You can't see it on your own.
Sound advice. So in terms of, um, how you got educated on your condition and, potentially, mistakes that were made along the way, if you had to redo, your journey to make it smoother, better for you and, your condition and the folks around you, are there any insights of what you would do knowing that what you know now versus what you knew then?
Yeah, absolutely not. I mean, everything has, I've been very, very fortunate. Everything has gone well. There have been no relapses over this 6-year period, so I'm very fortunate there because so many people do relapse and they're on their third or fourth line of treatments. I've had a
Yep.
single line of treatments, and fortunately, in this day and age, I think over the last 6 years, they've probably come up with another 20 lines of treatment. So I gotta, if I do relapse, I've got so many options that lie ahead for me.
Absolutely, absolutely. I mean, I think your story is one of hope because, sometimes people just think that everything's just falling apart. But really, you can have, success even on the first line of treatment, and it's possible, and you're proof positive of that.
I tell
Um,
you, it was interesting in the beginning where I was going to, because I was on this part of this clinical study, I would get tested monthly.
right.
Uh, and every month I'd go to, my wife always wanted to go in with me. And I was like, I work in the city, Sloan's in the city. There's no reason. It's, they draw blood. And
Right.
then, the doctor looks at you, make sure you're still, standing upright and still have two arms, two legs and whatnot. But every time I go in, I'd have the test done. I'd go into the portal a couple days later, and you'd get the results, and you're looking for an M spike, or actually you're praying you don't have an M spike, which is the indication of a protein that is produced by multiple myeloma. So, every month I'd take a look at the results of the test. The test would be negative, and it would be cause for celebration. I'd have to take my wife out to dinner. So that's, we kind of look forward to it.
Always a good thing. Okay, so in terms of the impact to the community that you're having and giving back, tell me about your work with MMRF. I think that's very interesting. You've been quite the prolific fundraiser for the multiple myeloma community. And can you tell us a little bit about what you're doing, why you're doing it, and how people can get involved?
I was not, my wife is the one who came across MMRF, Multiple Myeloma Research Foundation. She came across them online, and she saw that they had these interesting fundraising events, treks. They've got athletic events, hiking, climbing, whatever. And then they had these treks to various places around the globe. And she was like, you're a pretty adventurous guy. You should look into this. And I reached out to these folks, and the first trip I picked up online that I thought was real interesting was a hiking trek through Patagonia.
Nice.
Forgot how many days it was, but we visited some very, very remote areas in Patagonia. The one that really sticks in my mind was we climbed to the top of this rugged mountain, and to see condor nests, and it's a pretty wild adventure. There were 3 or 4 patients, and there were doctors, there were nurses. Then they had a team of 2 photographers. They had a drone that they create footage from, and I've got some pictures from this event that are just mind blowing.
Yep.
But you wonder if heading into something like this, especially the first time, like, who are these people? What are they going to be like? Is this going to be some sort of dreary, negative, depressing? And it was far from that. God, it was such a fun group. Plenty of beer was shared, and we had a great time. But
Absolutely.
as I mentioned earlier, my wife was like, okay, unless they do another trek to Bermuda, I'm out of this.
A little bit warmer.
Yeah,
So you went to Patagonia. You also went to uh,
Alaska.
Alaska and Guatemala. And basically,
Guatemala is coming up.
oh, coming up. Okay, got it.
Yeah.
And you raised, I think, over 60K, I understand, over the first,
First 2 trips.
treks.
Yeah.
Got it. I mean, how can and you're fundraising now for the Guatemala trip?
Just started. Yes.
Got it. Okay, we'll add the link right here. Please click there to help support. And would you encourage other patients and caregivers to attend these trips and participate in their own way with MMRF?
Oh, absolutely. You talk about, making lemonade from lemons. This is a perfect example. I've done and participated in some of the most exciting adventures. Um, I would never have done these things had it not been for multiple myeloma. So, you look at, it seems strange, but you look at the negatives and the positives. And in my case, I have to say the positives outweigh the negatives for the time being, thank God. Uh, so yeah, I would strongly encourage, and it's great being around other people that are facing the same battles that you're facing or have faced, and getting their perspective. It's great being around other patients. It's also great being around other doctors who can, you've spent all this time with your one doctor. My doctor, Dr. Hani Hussein, has been fantastic, but it's still nice to step out and get the perspective of somebody who may be looking at things a little differently.
Absolutely. Absolutely.
So,
Great. So we'll add the links there for people to potentially join one of these groups, as well as to donate to your upcoming trek as well.
yeah, feel free. That's strongly encouraged.
Absolutely. Anything to help the cause. So as a parting sort of final words, if people have one thing to take away from our conversation and that you want to impart on the multiple myeloma community, what's the biggest piece of advice you could give people on this journey?
If you're dealing with multiple myeloma, engage with others, engage with other patients. As I said before, if you have an opportunity to speak to another doctor, do so. Be careful when doing your own research. There's a lot of bad information out there, but I would say the most important thing is remain hopeful. There are a lot of lines of treatment out there. You may go through, 3 or 4 failures, and there's still plenty of avenues to explore to find, hopefully, a cure. And I don't know. I'm fortunate. I've been in a good place for quite some time where it's easy for me to be hopeful.
Right.
It may be difficult for some of you, but you got to keep your head up and keep the hope.
Excellent.
I think it's critical.
And Mike, how can people find you or communicate with you if they want to get in touch?
Um, the best way probably would be to shoot me an email initially. I'm more than happy to get on a phone and speak to anybody and everybody. I'm more than happy to meet with anyone and everybody. I look at my situation, and I see myself as having been blessed, and I think it's up to me. It's my responsibility to make myself available to those who perhaps aren't doing as well, and try to help them through these difficult times, provide them with assurances. And I think I'm a pretty good example of how one should carry themselves and deal with this, going forward.
Mike, we appreciate you giving back to the community, spending the time, in the ways that you do with the advocacy, and in all the other ways that you're impacting the community. And thank you for that piece of advice of engaging with others and remaining hopeful. You are the personification of that, and we really appreciate all that you're doing for the multiple myeloma community. So with that,
Thank you.
we will close, and we appreciate the time. Thank you, Mike.
Great. Thank you, News.
Got it. Bye-bye.